Good evening, I'm Jimenita Swain. Welcome to the Bahamas Tonight, the National Report. Thanks so much for tuning in. The Minister of Health revealed in Parliament on Monday that 15 healthcare workers were among the country's positive COVID-19 cases, with one death. But fears are increasing among that group as they carry out their jobs. Cleopatra Murphy reports.
More than 200 healthcare workers had been quarantined after unknowingly being exposed to a patient. Among that group were 96 doctors and 62 nurses. SANS, who last week said their loss is having a major impact on the delivery of healthcare, explains how and after what considerations they will return to work.
Most of these persons would have been at the end of their 14-day exposure. So certainly we expect the majority of those persons to be appropriately counseled, determine how they're doing physically, psychologically, and then to return to the workforce.
With the number of COVID-19 patients growing and hundreds in quarantine, Prime Minister the Most Honorable Dr. Hubert Minnis announced in Parliament that health officials are looking at tracking and monitoring quarantined patients to ensure they are not going out in public. The Minister of Health gave further details on how it will work.
The app that we have chosen actually has the ability to create a boundary, a virtual boundary, and if you go beyond that boundary, it sets off an alarm. If you travel to an area like a food store, a pharmacy, a bar, a restaurant, whatever, that can be pre-loaded into the software so that we know where people are.
SANS admits that it may intrude into residents' personal liberties, adding that the innocent may have to suffer for the guilty as some fail to stay at home. He says other monitoring options are also being considered.
Some people may decide, well, I'll just leave my phone at home and go out into the community. So there are other alternatives, looking at bracelets, which are not removable, so that for those people who have demonstrated that, look, for some reason that phone is stationary for hours on end and they're not napping, there are other alternatives that we have to look at.
While the minister says the country has been flattening the curve when it comes to COVID-19, he says more needs to be done.
We're not there yet. I think flattening is different than flattened. And so we'd like, and this is the reason why we have extended the emergency orders. It is too early now to say that this is now behind us. Are there some encouraging signs? Yes. Can we have guarded optimism? Yes. Can we hope to see better days? Yes. But that doesn't mean that we should throw caution to the wind and go out and undo everything that has been done over the last 6 weeks.
Cleopatra Murphy, ZNS Network News.
Home Minister Sands also said that efforts are being made to return Bahamians home who are stuck overseas amidst the COVID-19 pandemic. He reiterated the Prime Minister's announcement yesterday that the logistics are still being ironed out and government is in the process of finding a location to keep those people collectively quarantined. Sands says hotels and other facilities are being considered, but nothing has been finalized as yet.
As we flesh it out, we are aware that people have already contacted our consulates and embassies, and plans are starting to be made. Now, there are some other logistics because, to give an example, people in the United States, the state of Florida is not allowing people from New York to come to Florida. So if you're in New York and you want to try to make it to Florida, you may not be able to get there. You might be able to make it to Atlanta. Now, if you're in Atlanta and you came from New York, will they allow you to come in? I don't know the answer to that question. So there are some significant logistics that still need to be ironed out. But our goal is to look out for the interest of Bahamians and the Bahamas.